A common myth is if you've been pregnant or just due to getting older, that sneezing or laughing causes urinary leakage. This misconception is so widespread, it's taken as evidence that this is an unavoidable issue beyond our control. Because of this, many people keep doing their daily regular routines and workouts unaware that these may be contributing to their pelvic floor dysfunction. Hi, my name is Beth. I'm a nationally certified Pilates teacher and founder of Trifecta Pilates. The truth is, everyone has pelvic floor muscles, so anyone can experience issues with their pelvic floor. The pelvic floor is a group of muscles within the pelvis that act as a sling of internal support. Some symptoms of pelvic floor issues include leakage of urine or feeling like you have to go to the bathroom all of the time, stopping midstream but you're not quite done, difficulty going to the bathroom, pain with intercourse, erectile dysfunction, or even generalized pain in the lower back. Since there are so many symptoms associated with the pelvic floor, that's why it's really important to get personalized advice from your medical provider. Pelvic floor dysfunction can manifest in a few different ways, either decreased muscle activity or increased muscle activity, which is why Kegel exercises aren't always beneficial. In addition, there may be some areas of the pelvic floor that have increased muscle activity and others that have decreased muscle activity. Think about the simple exercise of a bicep curl. It's not at all uncommon that for a more dominant hand, that arm feels stronger when we're doing a bicep curl and their less dominant arm feels not quite as strong. These same imbalances can be seen in the body, including pelvic floor muscles. And for people with the uterus, they can have pelvic organ prolapse, known as POP. When it comes to Pilates and the pelvic floor, there are so many people who have said that Pilates has been beneficial for their pelvic floor function and health, where other people have said that it's actually been harmful. Both can be true because it depends upon the individual, the class, and exercises that someone's moving with. Imagine having a sprained ankle and trying to continue to run on it. It's only going to get worse and more aggravated. Sometimes with a sprained ankle, we may need to even walk in a different way or use crutches, really allowing the ankle to heal and recover. Eventually, we slowly start adding exercises in, walking in a normal gait, and even titrating back into running. We can do the same slow progression with Pilates, but so often when we're trying to get an effective workout in, we may push our Pilates workouts and exercises into a zone that aren't optimal for our internal core of support. Sometimes we may need to scale back our Pilates practice for it to be truly beneficial. There are certain positions and exercises that automatically require more support from the pelvic floor, therefore putting more pressure on them. As an example, laying down on your mat is going to put less pressure on the pelvic floor compared to seated or standing. Now, when we lift the hips up, such as in the pelvic curl exercise, that even puts less pressure on the pelvic floor, which is one reason why it's such a beneficial exercise, not only for spinal articulation and mobilization, but for the pelvic floor as well. Other movements that put more pressure on the pelvic floor, well, we already covered a few, sneezing and laughing, but we want to be able to sneeze and laugh without feeling like we're going to pee our pants. Or running, or any Pilates exercise where the legs are going to a straight position, like roll up or double leg stretch. And because these examples put more pressure on the pelvic floor, it doesn't mean they're bad, it just may mean at some times we may need to move with a different option. With Pilates, slower sessions that give you more time to refine how you move, fostering more awareness, can be really beneficial for your overall body and also for the pelvic floor. And this is what research has shown for Pilates and pelvic floor health, so that's not necessarily cueing directly to the pelvic floor muscles, which we now know is really ineffective. It's that we're working on overall alignment. So the simple act of ensuring that the feet and legs are in alignment with standing exercises or laying down onto the mat, that when the feet and legs go into a better aligned position, that works into the pelvis in a different way and influences our pelvic floor. In addition, focusing on deep diaphragmatic breathing, which is a little bit different than just focusing on belly breathing, is really helpful for pelvic floor health as long as we truly do diaphragmatic breathing and we're not feeling like we have to pull or suck in. We know that pulling or sucking in from our abs actually inhibits proper pelvic floor function. So we want that beautiful rhythm from the diaphragm. Also, Pilates tends to focus on posture, whether it's when we're doing our breathing practice or certain exercises are going to unwind tension, stretch muscles, and engage muscles in a different way as well so that we can stand more upright with more ease. So it's not about forcing posture in any one way, because that's also not helpful for our body and pelvic floor. But if we're in a slouched position, that puts more down pressure on the pelvic floor, which is why we want to focus on getting more aligned with our Pilates practice. So how do we determine what Pilates exercises are beneficial for our pelvic floor and which ones aren't? This is very personal and can greatly vary. I want you to think of planting a seedling. It's just planted, we just missed it with a water bottle. Once it sprouts and it gets a little bit bigger, we start using a dropper, like one of those science droppers from science class. Once we eventually transplant it outside, we go misting with the hose, which is different than misting with the water bottle. And finally, we go to a regular watering routine. But even with that schedule, we have to make adjustments as we experience heavy rainfalls compared to mid-August when it's hot and dry and temperatures are increased. We're going to continue to adjust our watering. And we can do the same thing with our Pilates practice. I highly encourage everyone to get started at seedling phase with your Pilates, even if you've been moving with other forms of exercise for a long time. That starting at the foundations can be really valuable, fostering deeper connections from the inside out. And taking time to slow down is going to be more beneficial in the long run as well. So you can get started with either the Pelvic Floor Safe Pilates class or the Foundations Pilates program, which is really beneficial because we get to review all the primary positions. You go through how to set yourself up optimally. Then we work with deep stabilizing muscles with different exercises and eventually go to workouts as well. And for a lot of people who have started with these sessions, they felt like it's really enhanced their overall knowledge of their body and also the Pilates method as well. Even those people who have been moving with Pilates for an incredibly long time. And once you move beyond these types of classes and you start to advance in your Pilates practice, there may be many days or periods of your life where you may come back to the foundations, to slower classes. This is exactly what I've done in my personal practice and so many people who I've worked with as well. So after I had both of my children, I went back to the foundations of Pilates, started with shorter sessions, slower, giving time for my body to continue to heal and recover before moving with more challenging and fast-paced Pilates sessions. And there are other days where things are just swirling around where I know a power Pilates class isn't going to be beneficial. What's going to be more helpful is moving with a slower class, and rather than doing the full expression of 100, doing either a bent leg variation or even feet down on the mat, or doing a class that doesn't even include the 100 exercise. Something to keep in mind is the more challenging a Pilates class or exercise is, the more it's going to automatically require more support from the pelvic floor. Just like running requires more support from the pelvic floor than walking, or sneezing requires more support than just simply talking. So faster paced sessions, straight leg ab exercises, even seated or standing work requires more support from the pelvic floor. So here's my recommendation. If you've been experiencing pelvic floor dysfunction for quite some time, work with a physical therapist who specializes in pelvic floor because they have additional training, tools, and resources to really support you during this time. Unless you've been told specifically not to work out, you can continue exercising. You're just going to adjust the intensity. So rather than running, walking. Rather than your power Pilates session, it's going to be a slower, Connect style Pilates class, giving you more time to tune in to different experiences and how your body is responding. And since so often with workouts, we've been told just to follow the teacher and not really tune in to what's going on with our own experience, it's not uncommon that tuning into different areas of the body, we may feel like we can't do that at first. Just stay with it, give it a go, try again, and it will come with time. There's some areas that we can feel and tune into more compared to other areas. The pelvic floor, as an example, many times we can't feel it engage. But if you've experienced pelvic organ prolapse, you may feel a heaviness with some exercises or movements. That would be an indicator to do a different exercise that doesn't increase the heaviness in the pelvic region. You can always swap out or opt out with different exercises. And know the more that you move with Pilates, the more you're going to find your go-to variations that are just right for you. Remember, by incorporating a strong foundation and incorporating pelvic floor safe Pilates exercises, you can have a positive experience towards improved alignment, deep stability, and a resilient pelvic floor. Because Pilates should always be beneficial for your whole body. My suggestion is either to begin with the full 4-week Foundations program within the Trifecta Pilates membership and app, and I'll leave that linked down below, or get started with the pelvic floor safe Pilates class that you're seeing linked right now. This one session is really valuable to move slower. It moves with very specific exercises that are pelvic floor friendly and gives you time to tune in to what's optimal for you.